Well, hello, everybody. Welcome to the Addictions Nursing webinar series. My name is Susan Blacker, and I'm one of the directors at large. And let me share my screen so we can get started. All right. This is the ASAN webinar series. Today's topic is mindfulness-based interventions that support abstinence and sustainable recovery. ASAN is the only national professional nursing society with full membership to all nurses who care for patients with addictions. ASAN offers free educational webinars to our members. We offer affordable professional membership, advocacy, collegiality, and companionship in nursing. This webinar has been approved for one nursing CE through the California Board of Nursing. At the end of the webinar, you'll get a survey in your email. So please complete the survey, and then you'll get another email to receive your certificate of completion. Okay. All sessions are recorded, so for those who can't make it live or want to go back and review it, you can. The CE is available for live or on demand, and you will receive your certificate for the on demand as well in the similar way. And if you've paid the nominal membership fee, all the webinars for all the years that we've been around are free to members. You can go back to a year or 2 years and do those webinars. So our speaker today is Rita Carroll, and she has worked in adult home and community-based rehab throughout her career. She has certifications in the practice of cognitive rehabilitation, CPCRT, brain injury specialist, mental health integrative medicine, and integrative health coaching. She and her colleagues collaborated on a book in 2021, Complementary and Integrative Approaches to Substance Abuse Disorders. Rita serves as the track director for Drexel University's Masters in Complementary and Integrative Health program, where she teaches multiple courses and has developed graduate courses, including Foundations of Integrative Addictions Therapies. And at this point, I will stop my share so Rita can load her presentation. Just a final note, we're not going to be having a webinar series in December. It's just too crowded, but we look forward to seeing you all in January. You will be getting emails about what that topic is. Thank you, Rita.
All right. So glad to be here. Thank you so much. Tonight, we're going to talk about mindfulness meditation, the evidence base and the application for use in the treatment and recovery from substance use disorders. The objectives I sort of tweaked a little bit, just trying to give you an idea of what we hope to accomplish before the end, just to be a little more specific. I'm hopeful that you'll be able to summarize the evidence base for using mindfulness approaches as part of an integrative approach to substance use treatment. I hope that you'll also be able to describe at least 2 second-generation mindfulness programs that were created specifically for persons with SUDs. And I'd also hope that you can model some mindfulness micro-practices. So just a preview of what we're going to be doing. We're going to go through an overview of mindfulness-based stress reduction. This is the program on which all other mindfulness programs are typically based. And it also leads to that evolution into the second generation of mindfulness-based interventions specifically designed for substance use disorder. We'll have a little conversation about your experiences as we go along. There'll be a mini case study. We'll do some micro practices so you can try some of these practices on for size. And then we'll wrap up with your questions. You are welcome when we take the breaks, either for the micro practices or to have a conversation about experiences. Please feel free to ask questions along the way. And I'm going to ask if we can start with an activity to help us get centered for the moment and sort of bring some real presence to our time together. So if you're seated, please really feel yourself in your chair, wherever your body touches a surface, just feel that connection for starters. I'm going to ask you to take a deep breath and exhale. And on the next inhale, see if you can let go of everything that came before this session tonight. Think about how you can release that and just inhale presence. And now see if you can do the same thing to let go of worries, ruminations, that constant to-do list that we're always putting together, and just bring real presence. And as you do so, connect to the sound of my voice, to the sounds you hear in the background, to the sensations of being here and truly present. And with that, we'll get started. So, in terms of trends in substance use disorders, when we take a look at some of these trends, we see that there is a real rationale for a more integrative whole person approach. Nearly 20 million people suffer with SUDs. Nearly half of them have mental illness. This number is on the rise at an alarming rate. There's some speculation that this is causing the decline in US life expectancy, with it contributing to some of the common chronic conditions. With relapse rates anywhere between 40 and 85% or more, there really is a need to create a new paradigm. Nora Volkow, who is the director of the National Institute on Drug Abuse, really believes that there is an opportunity for reversal of these trends, but that would come with innovations in treatment, a more comprehensive psychosocial approach. So, substance use disorders and mindfulness meditation, how does that work? Well, it used to be that we thought about addictions as sort of a character flaw, a choice, but we know it's a disease of the brain that advances as reward circuits become desensitized, and things like cue, reactivity, the stress response, and cravings are all strengthened. Continued use weakens the regions of the brain impacting executive functions such as focus, impulse control, and decision-making, along with self-regulation. And these skills, these cognitive functions, are all critical when someone is attempting to be successful in recovery from substance use disorders. The research on mindfulness indicates that regular practice, at the very least, can result in decreased reactivity to stress, which is incredibly helpful in recovery. So mindfulness-based interventions can be designed for treatment of SUDs and used to enhance outcomes when blended with more conventional treatment. So what is mindfulness-based stress reduction? I think we probably have all heard of Jon Kabat-Zinn. He and his team introduced the mindfulness piece decades ago in an attempt to provide more well-rounded care to folks who are dealing with pain and other kinds of chronic issues. What they began to do is to sort of create this program comprised of practices and classes where folks actually got to learn more about what mindfulness is and what are some of the characteristics of it. So the research was just exploding and has been even more so in recent times, where we can see its utility for all kinds of conditions. Kabat-Zinn defines mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And those words seem simple, but that's a very tall order and not something that's easy to do. We know that mindfulness in regards to substance use has the power to decrease the discomfort that we feel with negative mood states, pain, cravings, and environmental triggers that can often accompany substance misuse. It provides a foundation to address those stresses during early detoxification and abstinence, as well as long-term recovery. So it has usefulness across the continuum of that recovery. So my question to you is, let me see if I can expand my camera here. My question to you is, have you seen mindfulness meditation used in addictions treatment? During which stage of treatment and recovery was it used? And can you tell me a little bit about the practice and the frequency? Any takers? I guess no one has seen this being used, so that's okay. We'll continue on and I'll share some of those more specific practices. Let's see, we've got something in the chat.
Somebody from, Lisa Marie said yes.
Okay.
So I work in residential treatment in Washington State, and our program has a very, very strong mindfulness component. The day starts with a goal setting, and then mindfulness meditation in the morning, and then just lunch there's some meditation. And I think there are 4 formal opportunities throughout the day. Most of the people by the end of the so heavy focus on dialectic behavior therapy. And usually by the time people are done with our 30-day program, they are pretty committed to doing mindfulness meditation practice.
And can you tell me why they say that? I'd love for folks to hear if you know.
Well, because it really helped with anxiety, and virtually everybody who comes into detox is very anxious. And it helps them find who they are. And when they've been drinking and using heavily, they forgot their true selves.
Thank you so much for sharing. I think that's a perfect example of how it can be folded in to a day of treatment. When you give those touch points along the day, you give multiple opportunities to decrease that stress response and begin to help people understand what it feels like to have control over that feeling. When you know that you can turn off the stress response and turn on the relaxation response, it's incredibly empowering and really pretty uplifting too. All right, thank you. Hold on 1 second. All right, so some of the things we know about mindfulness: it helps to reframe urges and stress reactions, and it gives a more balanced perspective. It promotes the state of metacognitive awareness to better zoom out and see the big picture. That metacognitive awareness is sort of knowing what you know and thinking about your thinking. So when you realize your thought process and your mental state, when you bring that awareness, you also bring an opportunity to find a gap between an impulse and a reaction. And we'll talk about that more in a minute, but that metacognitive awareness is something that is really cultivated very actively in mindfulness practices. The literature says it supports initial recovery and relapse prevention by reducing dependence, cravings, and habitual use, and improving mood. And it seems like it has the greatest potential when it is combined with more conventional treatment. So Judd Brewer is someone who is a neuropsychiatrist. He has done a lot of work with habit change, and he views this as really sort of 2 pieces: understanding that cravings are just body sensations that we can be with, and mindfulness teaches the person who practices it to do exactly that, to be with however it is that they feel, but not get attached to it. And the second piece he talks about is that when you're really paying that close attention to it, kind of like that metacognitive awareness, you start to see that the results of the actions of use, the rewards, maybe they're not so great, and we start to become disenchanted with them. So tonight we're going to talk about 3 types of mindfulness. One is the formal practices that you would see in a mindfulness-based program. We'll talk about the micro practices, which are the quick hitting, do them fast, in an emergency situation, doesn't require much time. And then we will also talk about everyday mindfulness. That's kind of what you bring to the table as a lifestyle. All right, so formal mindfulness-based stress reduction. This is the original Kabat-Zinn that hasn't undergone any kind of real major changes in quite a number of years. But it's a standard 8-week program that meets for about 2 hours at a shot, with daily practices being strongly recommended, in fact required, that last 45 minutes. It sounds like a lot, and it is, but the idea is you're trying to flex that mindfulness muscle so it becomes more natural. The program ends with a day-long intensive workshop where you practice breath work, detachment from thoughts, quiet positions for presence, awareness, and acceptance. And you get a chance to practice each one of the signature mindfulness practices. The foundation for all of them is really about bringing attention to whatever arises in the present moment without judgment. So you can remain neutral when thoughts come in, you can observe them, acknowledge them, but then you can let them leave. So foundations of mindfulness, these are there are core attitudes that are reviewed in that 8-week course. It's not just the practice that you're doing. And these attitudes are brought out one at a time. A lot of time is spent with them. And these are sort of the underpinnings of all the practices. So you'll see overlap with some of them, but they're important to talk about. First is non-judging. You see non-judgment connected a lot to mindfulness. It's remaining in that neutral state that really brings sort of more of that metacognitive awareness. The other thing is people who are struggling with substance use disorders are very much criticizing themselves. And as a result, we want to give them an opportunity to kind of leave that be and walk away into a more neutral position. Patience and trust are required. Patience that the process will unfold. It is not something that's instantaneous. Trust that the process will unfold. Beginner's mind is something that you often hear affiliated with mindfulness-based practices. This is another one that when you practice it a little bit, I would suggest you try to do this tomorrow if you have a chance. But approaching anything, a person, a situation with beginner's mind really means that you are coming to that situation with no judgment. You're going to assume that even if you've known somebody for 25 years, that you're going to treat them like you're just meeting them and see them through fresh eyes. It can be an invigorating process, and I guarantee it will help you to see people and situations in a new light if you can set aside your former opinions, biases, experiences, history, and try to do it with fresh eyes. Non-striving is about not trying so hard for an outcome, but trying to just be in the moment. Acceptance is a similar thing. It's about accepting what is happening right now and not trying to judge or change it. That's also connected to letting it go. Just letting those preconceived notions, those thoughts, those feelings, acknowledge them, but let them go. So the other piece of this is cultivating some characteristics that you want to try to adopt: non-harming, generosity, gratitude, forgiveness, kindness and compassion. We're going to talk about a little bit, empathy and equanimity. So my question for you is, how might folks who have substance use disorders respond to adopting some of these attitudes, such as some of the core ones for mindfulness, non-judgment, beginner's mind, letting go, and forgiveness? And just feel free to chime in.
I would think that this would be a difficult thing, especially in the beginning, for non-judgment. I think there's a lot of self-judgment among those who have substance use disorders. And yeah, of course, they'll have a beginner's mind, and letting go, I think that's pretty tough too. And forgiving themselves, I think that's very hard. I think that's probably a lifelong effort. So I think it takes a lot of work.
It does. It does.
Hi, this is Kimberly Bleak. Can you hear me?
Yes, we can.
Yes. So I guess what strikes me is that, if someone in a, is in a program such as AA, a STEP program, really these concepts are things that they can use as they build through that program. The steps, just kind of thinking through that, you really learn, how do I manage some of the things and the repercussions of my substance use in a way that I'm not judging myself, in a way that I'm giving myself grace, that I am just learning how to navigate the world without the substance helping me navigate it, right? They're really just beginning to learn how to react, how they react without that substance in their system. Letting go of old habits, and understanding what those habits are. And then the forgiveness piece, of course, is really coming to terms with the things you're still holding on to that you blame yourself for, or others, and resentments. And so all of this could really support, I see those synchronicities there. So
there definitely are overlaps. And I think one of the things that I want to be really clear about is that mindfulness is not going to be ever an appropriate standalone for treatment. You can see, just based on what we've talked about already, the interplay, the need for lots of supports to address the complexity of the whole emotional, cognitive, and physical process. Thanks. Donna?
Am I on mute? Can you hear me?
Oh, we can hear you.
Okay, great. I just think this is fascinating. I think it's wonderful. I'm sorry I'm late. I just got out of class. And I think what you're saying just makes so much sense. But I honest to God think they need to have somebody who's skilled in this to really put it in a substance use disorder program. Otherwise, it's going to turn into a bunch of buzzwords for people.
I so agree. I so agree. And I did not include a conversation about that part, but the credentialing, that you have a trained facilitator or mentor. We'll talk about a case study in which that was a part in that regard. But you are so right. You cannot just have somebody take a mindfulness course or, weekend workshop and think that they're going to be able to manage this. And that is part of the reason that some of these second generation mindfulness-based interventions came up. I'm so glad you brought that up. Thank you, Donna.
Oh, thanks. I appreciate what you're doing. It's just fabulous work.
Sure. All right. Well, we'll keep on going then. Okay. So what are some of the core practices of mindfulness? You'll see most of these in any of the different programs that we're going to be talking about, but at the core is breath work, and I'm going to ask you to do it along with me in a little bit. But connecting to the breath is one of the easiest and fastest ways to bring presence. With that being said, it is also one of the easiest and fastest ways to bring anxiety to the table. Some folks are really not comfortable with that, going back to Donna's point about needing to make sure you have qualified people engaging in these practices with folks. This is why it is so very important. What typically is done is that everyone is taught all of the practices. Some will resonate, some will not. but that folks are invited to try them. And so this is, I think the breath work is something that once folks do it and find comfort in it, that's great. But sometimes it's a little anxiety provoking. So the facilitator would really need to be mindful of that. And people would need to be told in advance, and they are in these programs. Sitting meditation is sort of that classic meditation that you see. It's based in a Buddhist tradition. It's exactly what you think it is. It's sitting, in a position with a focus on breath, allowing thoughts to come in, but gently escorting them out. The body scan will do sort of a shrinky-dink version of that a little bit later on, but the body scan is helping people really get into their bodies and connecting their minds to their bodies, because our minds are often someplace else, not present with our bodies. So the body scan is really helpful with that. I wanted to talk about 3 more advanced practices that are part of these programs, because I think they have utility in specific situations that could be really helpful. For those who are very anxious, walking meditation is something that's an alternative to sitting quietly and trying to just focus on breath. It is not what people typically think of walking meditation. It's not about walking in nature and seeing the birds and, connecting with nature and that kind of thing. It's much more of an internal process where you are walking exquisitely slowly and paying attention to every part of your foot hitting the floor. The rhythm of it, the slowness of it, the focus of it is very meditative and very calming. And so when we're used to buzzing around and moving at lightning speed all the time, this is asking people to slow it down. And it helps with that whole process of sort of developing the cognitive and emotional skills that are helpful in recovery. Mountain meditation is probably one of my favorites. It's more advanced one, but it is so worth it. In this situation, one would do their own guided imagery to imagine being a mountain with stability. One is fortified, one is strong, one can handle anything. It's an incredibly powerful meditation that can help one feel like you can handle things. So this can often be used when there's a specific challenging situation coming up. I'm aware of people who use it when they feel like they're going to really be sort of tested. Loving kindness meditation, I think, is sort of ubiquitous. You see it all over the place these days, but it's important to sort of connect with all of the pieces of loving kindness meditation. It's also called Meta. So if you're looking around, you'll see basically the same script for it everywhere. But Meta or loving kindness is how you can sort of explore it a little further. In this meditation, it's a beautiful meditation. It is studied pretty actively by Kristen Neff, if you ever want to take a look at some of her beautiful work. In loving kindness, you are offering love, kindness, and compassion to yourself, and then to those you care about, and then to those maybe you're not so crazy about, and then the world at large. And people who use this on a regular basis, especially as a morning meditation, report feeling as if they can tolerate things a little better throughout the day. It sets them in a good mood. It sort of gives the warm and fuzzies. So there are many more practices, but this just gives you a sense of what some of them are. So I'm going to ask you to, with me, do some micro practices in breath work, and I will do my best to sort of signal you using my hand. I'll count it out for you to start with, and then I'll ask you to do it on your own, and then we'll check back in and see what you liked and what you didn't like. So the first is just conscious breathing. It's even breathing. It's, again, one of the easiest ones to do. You're typically breathing into the count of 4 or 5. Some folks like to go to 6, but let's just do it with me now. I'll give you an example for the first one, and then 2 or 3 more rounds on your own. So you're breathing in, 2, 3, 4, and out. 2, 3, 4, and continue on your own. All right. Next, we're going to try box breathing. This method is used a lot in emergency room situations, so it's one that seems to have utility for high anxiety and worry and even pain. So it's breathing in to the count of 4, holding for 4, out to the count of 4, and holding for 4. So I'll do one round with you, and you can do 2 or 3. So it's in, 2, 3, 4, and hold. 2, 3, 4, and out. 2, 3, 4, and hold. 2, 3, 4. Keep going for another 2 or 3 rounds. Okay, great. So you can see that if you engage your hand while you are doing it, it does become sort of a mind-body activity. And the last one is 4-7-8 breathing, commonly used in yoga. Andrew Weil really popularized this. This is being used along with other natural approaches to deal with insomnia. This one, I will warn you, you should not do more than 2, 3 rounds when you first start. It can make you feel a little breathy. It can make you feel a little dizzy. But if you sort of build that up, you condition your body to respond when you first think about starting this. So the literature on this is pretty interesting. So the first round is going to be in, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and out. 2, 3, 4, 5, 6, 7, 8. Go ahead with 2 or 3 rounds on your own. Okay, and I'll ask you to come back to me, and I would love to know what you think. What did you like? What did you not like? Do you see any utility for this in substance use programs?
I'm Claire, and
Claire.
I think definitely I like the box breathing, but just to start out the conscious breathing, I think just being able to, I don't know, really think about breathing, because if you're thinking about your breathing, then you kind of can't think about anything else. So I think it's good. I think you're right about that 4-7-8 breathing. That is a lot. So, but I like the first 2.
Okay. All right. And I think it's sort of a mixed bag with the 4-7-8. People either love it or hate it. And this way, there are options, and there are many more beyond what we did just now. Thank you so much, Claire. All right. And okay, so now we're going to talk about 2nd-generation mindfulness-based programs. They're the 3 that are most studied, and there are many others. Mindfulness-based relapse prevention, we're really going to focus on that. Meditation-oriented recovery enhancement, and mindfulness-based addictions programs, or I'm sorry, therapies. I'm going to go rather quickly because I can see I'm already starting to run out of time. So mindfulness-based relapse prevention really came out of a need to do something different, because mindfulness-based stress reduction was being used for an inner city program, and it was an epic fail. It was a poor fit. There was an incredibly negative response from the participants, who were largely African American and Latino women. So Amaro's research is really interesting if you want to follow up on this. But many of the women had experienced trauma and abuse and overwhelming stress from daily challenges. They wanted something that was more relevant to them and accessible and really help them with triggers and the stress that they experienced. What was interesting about this one is that they really listened to the group and said, what do you need more of? We will create a program for you. And in doing so, they made sure that the information that's in the manual that everyone received was more digestible. They shortened the practices to build in more success and sort of more, more practice, more time on task. And they were careful to avoid inducing memories of trauma. They also made time for more group discussions to really discuss and process their experiences in mindfulness, to ask questions and really have a targeted conversation over and over again about how to decrease habitual responses to triggers. So this became mindfulness-based relapse prevention. There is a quote that you often see when people look at this program: between stimulus and response, there is a space. And in that space is the power to choose our response. In that response lies our growth and freedom. And those are powerful words, because what this meditation boils down to in terms of a take-home strategy is this sober space meditation. It is one that gives people the opportunity to be able to find that gap between the impulse, the craving, the need and desire, and a thoughtful response to it. So they use the acronym STOP and, sober, and to stop and make the choice to shift out of automatic pilot. Observe what is happening in this moment. Gather your attention and focus on breathing. Expand your awareness and then respond with a conscious choice. And this group found this meditation incredibly helpful. So I wanted to share a case study with you. Some of this is directly from the words of a woman who participated in mindfulness-based relapse prevention. And also there are some thoughts about her program, just a little overview of it. So forgive me as I read her words because I want to get them right. But Louisa shares her journey from daily substance overuse, it was alcohol, for managing her stressors to greater awareness and more effective stress management. She said it started out as a wonderful little ritual. Each night after the kids were settled in bed, we sat down and had a glass of wine and shared the experiences of our day. I looked forward to this quiet time with my husband. We talked about the kids, work, finances, our worries, our hopes, our dreams. Over time, we found ourselves finishing a bottle of wine and then opening another. My husband wasn't all that interested in the extra wine, but I would keep having a splash more. And as the kids got older, the wine came out earlier. And soon it reached the point where I was having a glass as I prepared dinner. I mean, I can stop drinking if I really need to for a day or two. And that seems to be easy to do, but without a serious health consequence or responsibility that trumps the drinking, I still drink way too much at nights. But now that I think of it, I really only ever stopped for a short period of time. I never really tried to stop for longer than a few days. The other issue is that the wine seems to stimulate my appetite. I ate a super healthy diet all day and completely ruin it at night with incessant snacking. I know it's time for a change. I've gained so much weight in recent years. My blood pressure is up and I'm having difficulty feeling motivated to exercise. And I feel absolutely awful the next day. I know I feel better when I don't drink, but there's so many things I love about that glass of wine, and it's supposed to be good for you, right? Well, eventually Louisa did seek out treatment to deal with these constant feelings of being overwhelmed, functioning on overdrive, and the excessive drinking. And like many women, she didn't initially see herself as overusing alcohol. She just thought, well, this is just what people do when they're stressed out. She opted to seek support outside of a formal addictions treatment, preferring to see a psychologist and with a specialty in women's issues. And after assessment and several sessions, they talked about stress management, lifestyle changes, but Louise's psychologist suggested that she complete a physical, consult with a nutritionist, and enroll in a mindfulness-based relapse prevention program to begin to engage in formal mindfulness practices and use these strategies in her everyday life. She participated in sessions with a psychologist where they set goals, discussed stressors, practiced emotional freedom technique, and used neurofeedback. She attended a local mindfulness relapse prevention group where she participated in regular mindfulness sessions guided by a trained facilitator. These sessions included mindfulness meditation, body scans, and mindful awareness. And she explored her triggers for alcohol, which included situations where she felt overwhelmed, anxious, or faced with interpersonal conflicts. She created a personalized plan for high-risk situations that involved identifying alternative, mindful responses to triggers, such as deep breathing and grounding exercises, and seeking support in her recovery network. So over time, sorry, I got to move this here. 2 months after she had finished the program, she reports that she's less stressed, that her mood is better, and she doesn't sweat the small stuff so much. She reported better control, finding that she doesn't need the wine to settle down, and she created a new nighttime routine that included quiet stretches, breath work, and selective mindfulness practices that she had learned. She uses the sober strategy to address her urges to drink, but she uses it elsewhere when she's feeling stressed and overwhelmed. And today she engages in formal mindfulness practices each day and has adopted a more mindful approach to life with heightened attention, thoughtful choices, and a knowledge that she can find calm in the stillness. All right, so that is what mindfulness relapse prevention is all about. There is another program that uses the breathing space as an anchor. This is called MBAT, Mindfulness-Based Addiction Therapy. I won't go into any detail here due to time, but you can see that once again, the anchor is that space. And in this case, it's about using the breath work to get there. One of the best things about MBAT is that people report greater perceived volitional control over smoking and lower volatility of anger than those in the treatment as usual group. So it's something to investigate. All right. The last one is MORE, and MORE is a mindfulness-based program that was developed specifically for people with opioid use disorder. If you want to check out the work on this, you want to check Garland's work. The thing that is most interesting about this to me is the intentional focus. There is an intentional focus on savoring natural experiences, that it acknowledges, this program acknowledges that there is a dysregulation of the reward system. And when more natural, pleasant experiences can be savored and even recalled, that it shows that there are other ways to feel good. So with the MORE program, it's comprised of mindfulness, reappraisal, and savoring. The mindfulness piece is used to identify triggers to stop automatic responses to substances. It brings greater awareness. The reappraisal is a process of stopping and reassessing events to reframe the situation in a more positive way. This is the part where positive psychology comes in to this program. And then savoring allows that person to experience positive and pleasant events. This is a natural mood boost, and it promotes reward processing without using drugs. All right, so we're going to engage in a couple micro practices. This first one is called finger tracing. It's fun, it's easy to do, it's quick, and it is a true mind-body meditation that mobilizes movement and breath work. So I'll ask you to try it along with me. We won't spend a lot of time, but just to get a little practice with some of these. So in this situation, I hope everybody can see my hand. What you are doing is you are tracing up to the top of the thumb on the in-breath and down, and then breathe in and down. So we'll do a short round. So breathe in and out, in and out, in and out, breathe in and out, and again, and then you would come back. So this one gets us out of our heads, and instead of the focus really being the breath, even though that's there, the focus is really on the movement. Judd Brewer, who we mentioned earlier, is somebody who really recommends this method as an alternative. It's an active meditative practice. The next is the body scan. If you could take a moment with me as we move through these quickly. This is much more expanded in mindfulness-based stress reduction, but in this, you would sit or lie down. The idea is that you would tune into your attention, starting at the top of your head, and trying to soften it and relax. Sometimes using the breath to breathe in and release helps that body part to relax. So you would start with your head, and little by little, move down the back of your head to your neck, then to your shoulders and upper back. And each time checking in for tension, and then making sure that you are more relaxed before moving on to the next part. This is something that is really effective for folks who are having trouble settling down or sleeping. A great quick method can be done in just a few minutes. And the last of the micro practices that I wanted to mention is guided imagery. This is a way to quickly activate the relaxation response and decrease that stress response. It can be restorative, energizing, and help you to focus. There are tons of great guided imageries, very short ones that are out there, but you can do it yourself. And I want to just give you a chance to practice that very quickly. If you can take a moment to close your eyes or gaze downward softly, I'm just going to ask you to picture your very favorite place in the world. And just really try to get the full visual. Tune into how it looks. Imagine you're turning your head to look in multiple directions. See everything there is to see. And then breathe in the scents that are all around you. What do you smell? Tune into the sounds. What do you hear? What are you touching? How does it feel? And then you can move within this space and try to mobilize all of your senses to imagine that experience. And then take 2 deep, even breaths and come on back. Guided imagery can be very sophisticated. If you want to explore some of the guided imagery that is done for addictions, Bellruth Nepperstick, quite a mouthful, is someone who has done a beautiful job with creating multi-layered guided imagery for folks who are in recovery. It's a great resource. It costs a little bit to get it, but she's amazing. Okay, quick question. Which micro practice was your favorite? And do you see any utility for these practices?
I like the fingers, tracing the fingers. That was, they're always with you. So
Always with you.
yep,
Right.
it can kind of be, nonchalant in a way to use it and be non-conspicuous and just be able to pull yourself in if you get anxious about anything, really. So that was my favorite.
Yeah, it's quick and easy to do. And as I mentioned, Judd Brewer is doing a lot of work with this. It's his recommended modality right now. Great.
Yeah.
Thanks for sharing. All right, we'll get back to it and try to finish up here. So everyday mindfulness practices, it is a lifestyle, as I mentioned earlier. It can be folded into daily routines, eating mindfully, walking mindfully, engaging in cleaning mindfully. It gives you a chance to drop into the moment, experience it fully, and get a rich experience just by being present, as opposed to, being somewhere else in your head. Mindful decision making is really important. It gives us a chance to pause, reflect, and make deliberate, empowered choices that align with the goals that we've set for ourselves and with the things that give us meaning. Mindful communication and relationships, it can be incredibly helpful to express oneself authentically and engage in active listening. Doing so allows you to be fully present, and maybe you can engage with that person with kindness and compassion. And then mindful self-compassion is something that is a very big deal, sort of giving yourself a pass and not being so hard on yourself. I know that people who are in recovery or just starting treatment are so very hard on themselves. Giving folks a chance to be gentle and not judgmental in everyday life, not beat themselves up every time they do something. It's important. So these practices not only support recovery, but also contribute to a much more enriching and fulfilling life. They empower individuals like Louisa to approach each day with mindfulness, compassion, and resilience. So some of the takeaways here: mindfulness helps to develop awareness of personal triggers and habitual reactions, and learn ways to create a pause in what feels like an automatic process that we don't have control over. It changes our relationship with discomfort. It helps us to understand it's temporary. It helps us to learn challenging emotional and physical experiences and respond to them skillfully. It helps us to foster a non-judgmental, compassionate approach towards oneself and our experiences, and build a lifestyle that supports both that mindfulness practice, but also recovery and a life well lived. So some recommendations for future practice: we really need to get more diversity into clinical trials. We need to try to do research with various types of substance use, making adaptations from a position of cultural humility. The reality is that the participants in a lot of these studies all look kind of alike. So it would be great to use it in a lot of different ways. The other issue that came up with Amaro's work is just the lack of accessibility in the community and other settings of mindfulness to help people with substance use disorders. It's something that they can continue to engage in. It's so inexpensive. You need a facilitator that's credentialed and you need a room, but that doesn't cost very much. So there is a recommendation that we try to find more creative ways to get these practices out there in the community. So we know it's low cost. We know it's a non-pharmaceutical intervention that offers benefits to improve mood, cognition, and physical comfort. And if there was a pill that gave you those things, we'd be lining up at the store to buy them. So it's important to remember that this can be a really valued piece of an integrative approach. The evidence base is compelling. You cannot argue with it. It is there, and it is an option that is effective. MBIs have great potential in supporting abstinence recovery and relapse prevention, and I'm so thrilled to hear that they are being embedded into programs, and I just think we're going to see a lot more of this for all parts of that continuum. So, all right, just about in there, but any questions? Well, I appreciate your attention tonight. I truly do. Thank you for letting me run through that very quickly. If I can be of any assistance or provide you with any resources, please just reach out.
Thank you so much, Rita. That was so great. It was informative. It was things we can use in practice that's applicable. It was really wonderful presentation. Thank you again.
Thank you. So nice to be with you all.
Yeah,
Thank you very much.
All the best.